Welcome to America's Home Place 2025 Open Enrollment. First, let's start by meeting our Arista service team. You can call their Employee Benefit Assistance line at 866-370-3119 or email them at help@aristacg.com. They can help you understand your benefits, help with enrollment questions, claim issues, finding providers, or getting ID cards. Visit our new benefits website at the website link on the slide or also by scanning the QR code. You'll find lots of information about our plans and details that you can share with you and your family. Open enrollment is the specific time each year when you can make changes to your benefit elections, move from one plan to another, add family members, add coverage, or delete coverage. We recommend taking advantage of this time to review your current benefit elections and make any changes that you see fit. Please be advised that after open enrollment ends and your plan goes into effect, you are only permitted to make changes if you have a qualified life event, such as getting married, adding a spouse, or having a baby. If you do have a qualifying event during the year, you must notify Human Resources within 30 days of the qualifying event, or you will have to wait until next open enrollment period. Open enrollment will begin March 28th and end at midnight on April the 4th. We will continue to use the Employee Navigator enrollment platform. If for any reason you have trouble logging in, please contact Employee Benefit Assistance at the phone number or email listed here. If you're waiving benefits, we would still like you to log in to provide beneficiary information, as well as to confirm your mailing address. You will automatically be enrolled in employer-sponsored benefits such as basic life, short-term disability, and long-term disability. Open enrollment is the time to make changes. Mid-year changes are not allowed unless you experience a qualifying life event. Here are a few new and noteworthy changes for the upcoming year. For the dental insurance, we will continue to offer the low and high option, but we will have a new carrier, Sun Life. For medical insurance, vision insurance, accident, critical illness, and hospital indemnity, we will continue with Anthem. We will stay with Hartford for basic life insurance that the company pays for, voluntary life, short and long-term disability that the company also sponsors. There is one enhancement that took place on September 1st of last year that enhances your benefits from 60% income replacement to 66.7%. Next, we'll learn about who's eligible and review each benefit in detail. Eligibility for benefits includes any full-time employee working 30 hours per week. Your eligible dependents include a legal spouse, children up to age 26, or disabled children up to any age if disabled prior to age 19. Dependents who are not eligible include parents, in-laws and grandparents, siblings, nieces and nephews, and grandchildren. For more information about plan eligibility, refer to the written plan documents. Outside of open enrollment, the only time you can make changes include qualifying events. These include things such as marriage or divorce, birth, adoption or placement for adoption of a child, employment change or loss of other group health insurance, a spouse's open enrollment. You have 30 days to make that election from the date of the qualifying event. If you do go past the 30-day election window, you must wait until the next open enrollment to make the change. Let's take a high-level overview of the 3 medical plans that are available to you. Which plan is right for you? When looking at the high deductible health plan and you see 3 checks, those might be indications of which plan is best for you. If you'd like to have a tax-free HSA, which has no use it or lose it rule, and offers the opportunity to invest money for future medical costs, it might be the best plan for you. Also, pay the lowest premium, which may make it the least expensive option if you expect to have low healthcare usage. And finally, it might have the lowest possible out-of-pocket exposure for you. The core plan in the middle is a balance of your out-of-pocket and paycheck costs with a moderate deductible and premium costs. And finally, the buy-up plan. Pay the highest premium cost in order to keep your out-of-pocket exposure as low as possible when you need care at a doctor's office. The high deductible health plan will continue to have the exact same benefits as they are today, and we will continue to stay with Anthem. The benefit plan design is listed there at the top, followed by employee contributions at the bottom. There was a slight increase to deductions. However, the company continues to pay for the vast majority of health insurance cost. Our core medical plan with Anthem continues to have the exact same benefits as they are today. The deductible is unchanged at $3,500 for individual, with an out-of-pocket annual maximum at $7,900. The preventive care benefits are covered at 100% as defined by the Affordable Care Act. Other services such as physician visits or specialist visits are only a simple copay. Urgent care is $75, and then our RX benefits have a $300 or $600 deductible, which is waived for Tier 1, and then it's just a simple copay after that. The employee contributions are listed below, and the company still continues to pay for the vast majority of the overall cost. Over to your right, it does show the Level 1 versus Level 2 pharmacy benefits, and that determines the copay that you pay. The buy-up medical plan will also have the exact same benefits as they are today, also with no changes with Anthem. The deductible is $2,500 for an individual, with an annual out-of-pocket maximum of $7,900. The primary care and specialist visits are either a $25 or $50 copay. Virtual visits are terrific with a $0 copay. Urgent care $75, and then your RX deductible is either $250 per person, $500 for family, which is also waived for Tier 1, and then there are simple copays at the bottom, depending on which tier drug is covered. $15 for Tier 1, $35 for Tier 2, $75 for Tier 3, and then it is a percentage up to a maximum for the more expensive Tier 4 medications. While the company continues to pay for the vast majority of costs, there are some employee deduction changes listed at the bottom. As we think about optimizing your medical benefits, how can this help you reduce costs? There are 4 basic things that we talk about to help you lower healthcare costs. But it first starts by 2 concepts we've learned, which are to slow down and where you go matters. Find an in-network provider and schedule your annual preventative visit. Participate in the wellness programs, and utilize appropriate facilities for care. What we're seeing below is a grid that talks about things such as emergency room, retail clinics, walk-in doctor's office, and urgent care. Each can be used for different things, but they take more time and they can cost different amounts. With an urgent care, that may only take 15 to 40 minutes, and there are things such as same-day walk-ins. You can do sprains, stitches, x-rays, then followed by walk-ins. Those can take a little bit longer. Very similar to retail clinics, but they can also treat a few other things such as back pain, nausea, headaches. Then you have your retail clinics like CVS Minute clinics that you can treat for allergies, bumps, scrapes, burns, colds, and coughs. Those can typically be physicians or nurse practitioners and only take 15 to 24 minutes. And then as a last effort, we want to think about emergency rooms. But from a personal note, when we're all sick, the first thing we're trying to do is just get in and get out. But I would encourage you all to slow down and take your time with a physician. It's a time where you don't want to be there. You're looking to just get your prescriptions or your care and to go. But sometimes that can actually be the most costly. So I encourage you all to slow down, take good questions, take them to your physician, and then think, where do I need to go next? Because where you go matters. I can think of one situation recently with my own son that was taking a eardrop medication for a swimmer's ear, and the cost of that prescription ranged between $75 and $125. Use tools such as GoodRx. Think about what the cash price is for that particular prescription. Think about what it is and ask good questions so you can pay the least amount. The second story I have is an MRI that I've also incurred on my own knee. And I know that the doctor actually owned the MRI clinic, which was actually owned by the hospital. By simply asking some questions and shopping around, that MRI, which applies to my deductible that I have to pay, only cost me $450 by going to an independent facility versus paying over $2,500 for a facility that was owned by the doctor practice and the hospital. So I encourage you all to slow down and know that where you go matters. Let's look at your virtual care telemedicine. Benefits of virtual care visits is 24/7, 365 access to state-licensed, board-certified physicians. This requires less time away from work, no travel expenses, less interference with child or elder care responsibilities, and no exposure to other potentially contagious patients. Telemedicine is at a much further reduced cost, if not zero, for your plans. Doctor's offices can be a bit more expensive, followed by urgent care and emergency room, which can be cumbersome and expensive. One of the advantages of Anthem is the Sydney Health mobile app. You can download the app by scanning the QR code or registering at anthem.com/register. It has several advantages and everything can be done seamlessly in one app. Finding care, which doctors, hospitals are best for you. Looking at your health dashboard to see what's new on health topics of interest to you and wellness tips. You can chat, questions about your benefits or need help connecting with an Anthem representative. Virtual care, connecting directly from the convenience of your home. Community resources, and your own personal health records. One of the great benefits through Anthem is the well-being solutions. By focusing on your well-being, you can earn up to $700, and a sample of the listed benefits are below. $20 for a preventive wellness exam or a well woman exam, $25 for a routine mammogram for women ages 40 to 74, $10 for a flu shot, etc. Please note that these gift cards are taxable as income. How do you claim the rewards? To review your rewards, open the Sydney Health app or go to anthem.com. Next, go to the My Health dashboard. Next, select the rewards, then redeem rewards to see how much you've earned. Use your rewards towards electronic gift cards from popular retailers such as Amazon, Uber, Gap, etc. You have 6 months from when the current plan ends to redeem the reward dollars on your electronic gift card. And again, redeemed gift cards are considered taxable source of income per the Internal Revenue Service. For our dental benefits, we will have a new carrier, Sun Life. This does have a better network that means more providers to choose from. There are also some exciting new benefits on the annual preventive reward program featured on the right. On the left side, we will still continue to have a low and a high plan. The primary differences are the annual benefit max is $1,000 for the low plan and $2,000 for the high plan. Also, orthodontia is only covered in the high plan for children only that covers 50% of the cost up to $1,500 per lifetime. When looking for providers, at the very bottom you'll see a link to the Sun Life website that shows you how to find dentists. On the annual preventive care benefit on the right, we understand that getting preventive annual benefit care can be so rewarding in many different ways. Dental members can get additional maximum dollars added to their benefits based on their paid claims for preventive services. This promotes preventive care while providing additional maximum dollars for future years when you need it the most. The additional maximum dollars can be spent on any covered services, not just preventive services. As an example, the grid below shows if the annual plan maximum is $1,000, which is the low plan, your reward amount will be based on the claims for preventive services themselves, but you can get up to $1,000 in rewards. If you're on the high plan or the $2,000, you can get up to $1,500 in rewards. For the vision plan, did you know that a vision exam can also detect other health problems like glaucoma, diabetes, high blood pressure, and high cholesterol? So just by getting this exam can do a lot for your well-being. If you have an eye exam, you can get one every 12 months, and if you go in network, it's only a $10 copay. Lenses can be received once every 12 months. It's $25 in network copay for single, bifocal, and trifocal lenses. And frame allowance once every 12 months with a $130 allowance in network and 20% off the remaining balance. And finally, contact lenses, $130 allowance. Next, let's talk about the employer-paid basic life insurance and employer-paid disability benefits offered by The Hartford. On the left side, the life insurance benefit provides 2 times your annual salary to a maximum of $100,000 in the event of your death. For disability insurance, there are 2 types, short-term and long-term. Short-term disability provides 66.7% of your base weekly wages to a maximum of $2,500 a week after a 7-day elimination period or waiting period for a covered accident or a covered illness. Long-term disability provides a benefit of 66.7% of your monthly wages to a maximum of $10,000 a month after a 90-day waiting period. This benefit was 60% and has been enhanced to 66.7% for both coverages to ensure more income replacement. Voluntary life benefits continue with The Hartford. There are benefits for the employee, spouse, and child, and premiums are payroll deducted based on your age and how much coverage you purchase. For employees, you can get increments of $10,000 up to a maximum of $500,000 or 5 times your earning. If you are a timely new hire, you have guaranteed issue coverage for $200,000. For spouses, you get $5,000 increments up to $250,000 or up to 100% of the employee amount. Again, if a timely new hire who is purchasing spouse coverage can get up to $30,000. And for children, it's $1,000 increments up to $10,000 or whatever 100% of the employee benefit amount is. Again, guaranteed issue is $10,000. Age reduction schedules do apply, so benefits do reduce as you get older in age. But just a reminder, the guaranteed issue only applies if you are a new hire. Let's review some of the supplemental health products offered by Anthem. Critical illness is the first. If you suffer a heart attack, stroke, major organ failure, kidney failure, cancer, progressive diseases such as Alzheimer's, or supplemental conditions such as a coma or permanent paralysis, these coverages can all be paid in a lump sum benefit. For you, you can choose a $10,000, $20,000, or $30,000 benefit. For your spouse, they're eligible for 50% of the employee amount, and for children, they're eligible for 50% of the employee amount. These coverages can help you pay for unreimbursed medical expenses when you have deductible and out-of-pocket expenses for these types of conditions. Next, we have accident insurance. Accident provides a set of benefits based on the type of injury you have and the treatment that you need. It provides a cash benefit directly to you in a lump sum tax-free payment. There's no medical questions or exam needed to enroll. You can take coverage if you leave, and there's no limitation for pre-existing conditions. A sample of benefits include things such as a coma, which will be a $15,000 benefit. Hospitalization would include $1,200 per admission, then $250 per day, $750 per day for ICU. Ambulance benefits for $1,800 for air and $300 for ground, and concussions at $200 are just some samples for you. Your premiums are over to the right. And finally, the hospital indemnity benefits. Hospital indemnity provides a lump sum cash benefit to help pay for the cost with hospital stays when your health insurance doesn't cover it due to your deductible and co-insurance amounts. Why is this coverage so valuable? Cash benefit is paid directly to you in a lump sum tax-free payment. Covers hospitalization for normal pregnancy from day 1 with no waiting periods. You can take your coverage with you even if you leave your employer and keep the same rates for 3 years. And finally, no pre-existing conditions. As a sample, if you had a hospital confinement, for the first day you would receive $500, then $150 per day or $300 per day for ICU. As part of the Anthem Accident, Critical Illness, or Hospital Indemnity Plan, you can earn $50 for each of the plans by having a health screening, such as a mammogram, colonoscopy, fasting blood glucose test, or one of many common cancer screenings. You can receive the benefit by calling the phone number listed below and then submit your claim. A test will be confirmed and you'll receive the check. You and your covered dependents can each earn one $50 screening benefit for calendar year. Eligible tests are below. Now let's take a look at our Employee Assistance Program, also known as an EAP, by the Hartford. The Ability Assist Counseling Service is offered at the telephone number listed to the right and the website. If you're a first-time user, you can click on the registration tab and follow the instructions below. An EAP program is really there for complex challenges of life. The unexpected happens, and you just want a simple solution to help cope with the stress and life changes that may result. This is why the Hartford Ability Assist Counseling Service, offered by ComPsych, can play such an important role. It includes 3 face-to-face counseling sessions per occurrence per year and unlimited telephonic support for financial information and legal support and resources. For those of you enrolled in the high deductible health plan through Anthem, you're also eligible for a health savings account known as an HSA. This allows you to save money before taxes and use those funds to pay for qualified medical expenses. Again, you must be enrolled in a qualified high deductible health plan to participate in these benefits. Some of the advantages are these funds roll over from year to year. There's no use it or lose it rule. You can even invest some of your HSA funds. Funds can be used for you, your legal spouse, and your tax dependents, so long as they're covered under a qualified high deductible health plan. There is, again, no use it or lose it rule, so your funds can be for current or future medical expenses. Deposits are exempt from federal income tax, and individuals that are enrolled in Medicare are not eligible. For 2025, each year, these benefit amounts that you can contribute go up. The pre-tax contribution limit for an individual is $4,300, and for family coverage, it's $8,550. If you're age 55 or older, there's a catch-up contribution of an additional $1,000. These limits are defined as a calendar year. Here are a few helpful, important reminders. When enrolling in your benefits, make sure to speak with your spouse or family members to determine which options are best for you. Next, log into Employee Navigator to make your 2025 open enrollment elections, whether enrolling or waiving in coverage. And don't forget the April 4th deadline. Log into Employee Navigator to confirm or update your beneficiary and mailing address as well. A reminder, you cannot make enrollment changes outside of open enrollment unless you experience a qualified life-changing event such as a marriage, divorce, childbirth, legal adoption, etc. Member ID cards will be shipped if it's applicable. And don't forget that all these changes take place May 1st, 2025. What are your next steps? Log on to Employee Navigator during open enrollment from 3/28 to 4/4. Review your personal and dependent information. Follow the online enrollment system prompts for open enrollment. Then click on Complete to finalize your elections and print a benefit confirmation statement for your records. A confirmation email will be sent to your email address on file. Thanks again for attending our 2024 open enrollment. As a reminder, you may always reach out to us for your one-on-one assistance needs. Insurance can be overwhelming, and it's complex, and Arista is standing here happy to help. Call us at 866-370-3119 or email us at help@aristacg.com.